Well, now let's talk to the heavy lift.
The big dog.
Yeah.
So IVF is not just one thing. It is multiple things. I think IVF is like just the umbrella, right? In vitro fertilization is the umbrella. But in vitro fertilization in the most basic, straightforward format is split up into two categories. We have what we call a retrieval cycle, and then we have a transfer cycle. And essentially the goal of the retrieval cycle is to get your body to excessively respond to the medication and produce as many viable eggs as possible, right? So let's say your body cocoa naturally creates about 4 to 5 follicles on its own without without drug intervention, right?
Mm-hmm.
The goal during that retrieval cycle is to get it to respond about 3 to 4 times as much as that, right? And so we're really pushing you. That's why women feel really crappy during that. You know, you feel really hormonal and lethargic and you're bloated. You may even gain some weight, retain a lot of water because it's a huge process, right? And the idea is you'll go into the office one day and they'll retrieve, right? They'll retrieve those eggs. They'll take your partner's sperm and they'll sit it in a lab for a few days. Best practice is we wait about 5 to 6 days where we get them to not just sit next to each other, but we'd hope that they've come together and they've created something called a blastocyst, which is a replicated cell. And that's going to give us the confirmation that this is a good, viable embryo. Now, for some couples at that point, what needs to happen is they're going to either send that embryo to a lab to do something called pre-genetic testing, but it's not required for anyone anymore, right? So if you don't have any concern for any genetic testing, you can skip that altogether and decide not to. But if you do, definitely send it. And pre-genetic testing can take anywhere between 1 to 3 months, depending on the depth of testing.
Really?
They're going to test your chromosomes. They're going to test to make sure that things like sickle cell aren't carried, right? Which is really important, especially if both of you are AS, and so for sickle cell. And then after that, what typically happens is in the United States, best practice is to freeze those embryos. There are still some doctors that do fresh transfers, and the fresh transfer essentially means that those embryos that have been replicated to blastocysts are going to get transferred within a couple of days. Whereas the frozen one, we're going to put them in the storage, we're going to freeze them, and then the idea is in about a month or two, however long you want to wait, a couple years down the line, you go ahead and then do a transfer cycle. And then the medication for the transfer cycle is completely different. Those medications are really going to be tailored to make sure that there's something called uterine receptivity, right? Where your uterus and the lining of your uterus can successfully implant that.
So it's trying to get your body to the place where it would be naturally if you had naturally conceived.
Absolutely, exactly. And it does push it to the limit a little bit because some people just have different reasons why they can't implant very well. And so the idea is for that. And so that's the most like basic format. But there are multiple types of different things that need to happen. Like there's different procedures that may need to happen in between, like ICSI that I talked about, right? We might have to do some things with the sperm. Some people may be able to produce their own embryos, but may need a surrogate. And so that we may freeze those eggs and send them to another place to transfer into a surrogate. And so IVF really does encompass this interesting process where at certain points, whether it's a donor sperm that we're getting or donor egg, we can introduce that into the process.
So you mentioned the IUI cost is about $500 to $1,000 per cycle.